Venus Winder is battling typhoid. The illness slows her down, but she has no choice but to keep working. She desperately needs the money to pay for her treatment.
The public hospitals keep sending me to outside pharmacies because they don't have some of the medicines that I need. They gave me some, but I have to buy others.
And she's not the only one. Most people in this area of Dar es Salaam rely on the state for health services.
Government dispensaries like this one often don't have basic drugs like paracetamol used as a painkiller and to treat fever. The majority of people in this community depend on public health services. When they can't get the medicines they need, they have to spend their money at relatively expensive private hospitals.
Watchdog organization Sikika says government-run medical stores only have half the drugs they need, a shortage that's existed for years.
At this point, it has reached the critical level where we see 50% of all the medicines in the catalog list are zero stock, and some of which are, necessary for necessary conditions for essential medical conditions.
So far this year, the government has only released a third of the money needed to buy medicines. Poorly run stores and delivery delays are worsening the problem. Tanzania's Health Minister Umi Mwalimu did not respond to our calls, but her department issued this statement.
We expect the medical situation in Tanzania to improve and stabilize. The medical stores will use long-term contracts to make sure that the delivery of medicine will be quick and on time.
Local drug manufacturer Shelley's Pharmaceuticals no longer supplies the government because of high production costs. That's due to import duties on raw materials. The government instead imports cheaper products from India and China, which take months to arrive. Local producers say they could provide them in a third of the time.
Around 30% of the requirement of the drugs are done by these companies which are manufacturing in Tanzania. 70% is imported. Now, this 30% can become 50, 60, 70, 80, 90% if, these duties are removed by the government of Tanzania.
The government says there's no need for concern. Venus doesn't quite see it that way. Fahmida, Al Jazeera, Dar es Salaam.